Okay. Thank you so much for having me here, Heloise. Thank you for putting this event on. As you said, I am the chair of the Down Syndrome Research Foundation. We are frequently, over the years, called up by reporters with the latest advance in screening technology, and aren't we excited? And would we like to make a comment? I'm going to be focusing mainly around the development of NIPT and how we were involved with Public Health England, but as I said, I want to kind of get you to place yourself in the timeline that we're in. We're a part of things changing, we're a part of history being made. This case is history being made in front of our eyes. And I think it's really exciting because we've thought about Down syndrome in one way only, and we are hearing from people with Down syndrome that they are more than just a medical diagnosis, that they have full lives. They want to tell us about that, and they actually would like to assert their rights in society as well. I'm joined by Colette, but I'll begin the presentation. Okay. Right. I think importantly, I want to note my conflicts of interest. You'll see later, I think it's quite important that anyone who's involved in presenting, that they show that actually they may not be totally free from conflicts of interest. As I said, I'm a chair, I'm a volunteer, I accept no money for that role. I also support advocacy work as a part of that. I support the Don't Screen Us Out campaign and also Heidi's Case campaign. My pleasure, Heidi. And I'm also a doctor in private practice. So my involvement began, I think, around this work. As I said, we're frequently called on the latest advance, but this piece of work around, the other name for NIPT was cell-free DNA testing. We registered a stakeholder, so you can register with Public Health England as a stakeholder organization to say that you have, say you're a breast cancer charity, that you register with them, that you're involved, you're interested if things change around screening policies to do with breast cancer screening, you want to be notified, you want to be able to have a say with consultations. So we had been registered for many years but hadn't been contacted, and then I was in touch with one of our supporters who let us know that a consultation was beginning around cell-free DNA testing, and would we like to submit a consultation submission, which we felt was extremely important to do so. All along, we felt that there is a huge vacuum around ethics and prenatal screening. So as you'll see, this is a big theme that comes up again and again. And I want you guys to kind of get a feel for what we submitted to them. It was a huge document, but I've just included the summary points from that submission. First of all, we felt that due regard needs to be given to ethics. Again, as I said, it's been missing, and whenever policy changes, whenever they're proposing any changes to any kind of interventions, guidelines, screening policies, you need to revisit the ethics. Is it an ethical thing to do? How does it impact the people involved and the wider society? And it seems to be that it's just acceptable that ethics has just been missing from the discussion around screening for so many years. So we felt it was very important that that was also placed within the context of the Equalities Act and, importantly, the Convention on the Rights of People with Disabilities. Critically, we wanted to have the voices of people with Down syndrome heard. What did they think about this change? Because it definitely would affect them, it would affect their peers in the future as well. We felt very worried about the fact that prior to the suggestion to the National Screening Committee about changing the screening program, there had been clinical studies done to investigate this new groundbreaking technique of collecting placental cells from the mother's blood, and how exciting it was that there was this new technology. Unfortunately, we were very concerned that there was a great amount of bias involved with the people involved in introducing this to the National Screening Committee, and also some charities being involved in the clinical study as well. And a lot of this not being publicly declared, companies who do cell-free DNA testing giving funding to some of the charities involved. We felt all of this needed to be publicly declared, and it was important that interested parties declared their interest. Again, this issue with information. This has been a long kind of running problem. The kind of, not only the sort of dichotomy between the different models of medical model of disability, but also the social model. What is the lived experience of people with Down syndrome? How do they feel about their lives? And thankfully, over the last 5-10 years, we've collected a lot of evidence of actually from people with Down syndrome's own mouths, how do they feel about their life? How do they feel about life in this modern society and their life chances? And I feel that this should be reflected in the information given to mothers. They should know how actually, their potential life outcomes for their child. And unfortunately, the information given, we see again and again, is very heavily loaded towards the medical model, towards feeling like boxes have been ticked. The mother was informed that, this could go wrong, that could go wrong. It looks like a legal document in terms of, please sign at the bottom that you've consented to continue with this pregnancy kind of conversation. It's very loaded in that one direction. And our concerns that this pathway, should a mother say early on, I don't want to be screened, I don't want to be a part of the screening program, it's loaded towards catching these missed fetuses when you also offer the screening through the ultrasound as well. So this idea that the pathway, again, just keeps trying to pick up women who have declined screening. So it's not actually informed choice, because when your choice isn't respected and you're being questioned again and again, it's more close akin to medical gaslighting. And as I've said, again, the equality legislation wasn't considered. It needed to be thought about, and we needed to think about the, people with Down syndrome and their point of view. They needed to be meaningfully consulted around these issues and how this change in this screening program, how that would affect them and their quality of life. So we submitted our document, and I don't know where these things go, but they just disappear into some filing cabinet at Public Health England. I'm going back. Okay, so step forward to 2016, and we're invited to join a special subcommittee. So Public Health England have a committee called the Fetal Anomaly Screening Program, and as a part of that, there's a number of subcommittees where stakeholder groups may be involved. And we were contacted because as a result from the National Screening Committee telling the NHS that they would like them to introduce NIPT testing to the NHS as a part of an evaluative rollout. So they wanted us, the screening program to change to include this, and they wanted them to redesign the screening pathway to include this. And that would mean that the booklets needed to be redesigned. This is the booklet that every pregnant woman receives. It's called Screening Tests for You and Your Baby. And they had invited us to join this subcommittee to work on redesigning this booklet, not only to incorporate the changes that had to be explained to the woman about this new test, this new screening test, but also to talk about how do we train our midwives, what are we going to say, and also a chance to revisit the sections where they discuss Down syndrome and also the other syndromes that are screened for. So a number of stakeholder groups were present, including stakeholder groups that support women through the decision whether to continue with their pregnancy or not. How to describe involvement as a stakeholder. I feel I had an advantage over someone who might typically be in my role because I had been trained as a doctor, so I felt a little bit more confident. I suppose I'm just trying to give you a picture of what it's like to be representing people with Down syndrome. I think people with Down syndrome should have been on that committee. I think it's important to say that at the outset, because I think it's important that you understand that I don't think I'm worthy to speak for them. I'm holding a place for them. When you join these committees, it's clear that everyone there knows each other, that it's a formality. I think that there's a number of people there who very earnestly want to hear what we have to say and try very hard to include our points of view. But it is a very difficult setting to walk into as a stakeholder, going to the big Public Health England body and trying to be a part of it. We have a wonderful chair in Professor Louise Bryant, who is actually a sibling of someone with Down syndrome herself, so I felt had a unique understanding and has done research around screening. So at the same time that we were involved in this, our kind of our charity's campaigning was continuing, and we met with the Department of Health. We continued to lobby with them to do work around the ethics of this. And at the kind of moving in parallel, Nuffield Bioethics body said that they were going to do a consultation around the ethics of prenatal screening. So I was very pleased to see that that was going to happen. We were all very hopeful, and we lobbied hard that they would actually also meet with the people with Down syndrome, and they did do a piece of work around meeting and hearing the views of people with Down syndrome around prenatal screening. So I can talk about that later if people want to in one of the panels. Okay. Oh, I'm just not going to get the hang of this button. Okay. Oh. Okay. I think it's got a bit of a lag. Okay, this is a very boring document that shows you the actual official flow diagram, and the big arrow there is where stakeholders get involved. I think it was really interesting that you shared, Heloise, a couple of quotes, because I straight away remembered those quotes and how we argued about those quotes. You know, this inclusion of people with Down syndrome will have a learning disability. It initially was a lifelong learning disability. You know, and we argued, why do you need to include that word? You know, we argued back and forth about a lot of the language in that booklet. And there was a particular section that talked about it. The way they initially wrote it said, unfortunately, 10% of people with Down syndrome won't make it to adulthood. And, you know, why had they included that statement? And I felt, actually, all it did was show that many of you will have read the leader report, that the poor care that's received by people with learning disabilities on our medical wards. And actually, when was that study done? You know, was it actually back when we weren't even offering correctional heart surgery and gut surgery to our neonates? It just reflected to me poor health service, and actually what would be that true number. We argued back and forth, and eventually what they said they would put in, that again I feel unhappy with that it's still in the current book, is unfortunately 5% won't make it to their first birthday. Which again I felt very frustrated, because that was based on old research and again reflected poor medical care. And the study is being repeated, but I even wrote to the person who did the study to try and see if she had any new data. We're very poor at collecting data around the medical care of people with Down syndrome. And again, there's not enough medical research that goes into help. But people with Down syndrome's life expectancies have just been rising. So I feel that, you know, part of that has been that we've afforded them medical care at all. Which seems, you know, ridiculous to even have to say, but I think it's important that we include it. And is it right that we reflect that in one line in a booklet when a mother's sitting trying to decide whether to continue their pregnancy or not? She won't understand what that line means, and I won't be able to explain that to her. It's just there. So unfortunately, you know, it became clear that it didn't matter what I had said in many of the meetings. I put it across and fought a corner as best I could, but some of those things were going to remain. So we did, myself and our charity and another Down syndrome charity present at these meetings issued a joint statement, because we felt concerned that the final document would reflect poorly to our community. So I felt that we needed to sort of let people know that our involvement had limits, and that we would do our best, but that the final decision with what went in that booklet was down to Public Health England. Okay. Got it. Right, got it. Okay, so final thoughts on our involvement with this subcommittee. The training events, which Colette's going to speak a little bit of, she represented us at the training events where midwives, sonographers, obstetricians attended training events and learned about NIPT and how it would work. And we're working towards the label of being an NIPT champion. How does that sit with everyone? I mean, you know, does that actually a label of good medical care rather than just being a good healthcare provider? Actually, to champion something which actually had been used widely in the private sector, had been advertised very well, then you become a champion, it felt, of a product. Not of women's choices, or, you know, there's a lot of ways that they could have labeled that, and I just felt this was such a loaded title. Only a year in where we asked for a conflict of interest. I just felt that, again, was remiss. As I said, there was people there who were benefiting from the adoption of this new technology. There were people that had received grants from companies that provided this technology. I felt it's important that they declared that openly, and it affected their decision-making. We had asked for an equality impact assessment. It is still forthcoming. It might be in the post, but I don't think so. And a lot of times throughout this process, when the book was being revisited, we felt it's important to talk to women about what are their choices, including the choice of adoption. I feel that that's something that is a great taboo to speak about. It's mentioned in some of the National American booklets. Why can't we mention it? It was in one of the initial revisions of the booklet, but it was cut because it was felt it's not within the remit of the fetal anomaly screening program. But this is the booklet you receive when you're pregnant. This is the booklet that the NHS provide to you on your pregnancy. And it's around screening. It's not around pregnancy. So I felt that it's important to include that if we're going to truly provide women with a sort of range of their choices. And the other thing I think we kept mentioning was the fact that once women choose to continue, they are repeatedly, as I've mentioned, offered determination again and again and again. Are you sure? Are you sure? Are you sure? One of the reasons I think that happens is the absence of pathways. There's a clear pathway for doctors, nurses, midwives to follow around termination, but there is no clear pathway for people to be supported through an effective pregnancy. So to support them through extra scans, through possible psychological support should they need it, through connecting them with peer support. And in the absence of that, I think it does affect doctors' practices when we don't have that supporting document to help us to show and provide good medical care. So I think, again, we worked with them. They said that's not within the remit of FASP, and it would, they recommended the Royal College could do it. We're still, again, waiting for that to happen years later. I think it'd be a good chance for you to jump in because I've just been rabbiting on. So maybe you can tell people about what the training event was like.
Yeah, thank you. Can I work your slide? There we go. Okay. Yeah. So this is me basically. I'm here partly because I produced this, but this was as a result of going and observing and feeding back on the training event that was offered. It was quite upsetting in a way because going there, everybody was really excited about the new test, a bit like what Liz was saying earlier. It was like they'd found this really cool thing that could detect babies with Down syndrome, and that was where the thought process stopped. They weren't thinking about the implications of that we have a 90% termination rate when parents find out. Now, the reasons behind that 90% termination rate are probably for another time, but it was like that thought process did really stop. And with the National Screening Committee, the comment I wanted to make about the ethics was 3 days after they made the decision that they wanted to implement NIPT, that was when they had ethics training. And so actually it really shows that things were in the wrong order, and the conflict of interest forms, a particular person filled in a conflict of interest form and did declare that she received funding from the companies, the manufacturers, about 6 different companies that manufactured NIPT. And she declared that that wasn't a conflict of interest, and she was continued to allow to be sat on the committee making those decisions. So again, it was people not thinking, really. It seemed a bit like a tick box exercise. At the training itself, it was that I met a lot of people who'd been previously involved in cancer screening. That had been their work. And so they hadn't, cancer screening is a good thing, right? Because then you can detect it and you can fix it. But they hadn't really seemed to think about the implications again of what this type of screening meant. And one of them did actually say to me afterwards, speaking to me, that they felt much more comfortable working on cancer screening than they did on prenatal testing, because it does instinctively raise issues for us that we don't really want to confront. During the training, there were 2 days of training, and it was astounding that at the end of it, the midwives still did not seem to understand that an NIPT was not a diagnostic test, that it was not useful for 1 in 2 to 1 in 150 chance of having Down syndrome because of its lack of accuracy, really. They were fixated on the advertising. Oh, it's 99% accurate. And did not still seem to understand the positive predictive value for that woman was not 99% or any way, shape or form, even after 2 days of training. So when we talk about informed choice, if we can't even inform the medical professionals, how do we inform the women? It did really seem that the advertising, they just swallowed it, hook, line and sinker. It was a brilliant test and it was great. Even the study that fed into the National Screening Committee was called the Reliable, Accurate Prenatal Non-Invasive Diagnostic Study. It's not diagnostic, right? So there was bias everywhere. If you look at the language, there's bias everywhere. And there was confusion as well amongst the people about the difference between the law and the pathway that was being introduced. So the same charity that mentioned that had been funded was very keen to point out to the midwives that a woman could have an abortion at any stage, and that they didn't need to have diagnostic testing, whereas the pathway that was being presented during the training was absolutely, because the health professionals recognised, or at least Public Health England recognised, that NIPT was not diagnostic, and that women must have a diagnostic test before they go on to have a termination, to just check that NIPT actually had delivered the result that they thought it had. And talking about the pathway was mentioned. Royal College of Obstetricians and Gynecologists were developing a pathway for women who wish to keep their babies. That was about, 5 years ago? Still not here. And there are a lot of women who have been pregnant in between that time. Well, from the conference, I picked up that there was likely, and from the research that I'd read, it looked like there was likely to be a reduction in birth rate once this test was introduced, and nobody seemed to be talking about that. They seemed to be brushing it under the carpet, that there would be fewer people with Down syndrome around after this test was introduced. So I did collect some data using a Freedom of Information request. Lots of Freedom of Information requests to every hospital in the UK, and it's not been published in an academic literature, unfortunately. We've come across quite a lot of hurdles to that, and we're not sure if it's because it's uncomfortable data or why. We're still trying. It was published in the Sunday Times. They accepted the conclusion that where NIPT had been introduced, there was a 30% drop in birth rates in those hospitals. Because this is an evaluative rollout of NIPT, we had hoped that they would look at that, because actually that has implications for services for people with Down syndrome and expertise. People aren't going to train in Down syndrome if there are fewer people with Down syndrome around. But apparently not so far. We keep pushing, we keep asking, but it's not clear what the evaluative criteria is. And then, yes, part of me Part of me does still believe that there are a lot of medical professionals who do want to do the right thing. They want to say the right thing. They want to, but they don't know what that is because all their training has used words like risk and problem and abnormality and talked about children and babies and things like that. But we are talking about an issue that affects the whole population of people with disabilities, and people with disabilities are not just children. They go on to grow up and be adults and become participatory members of our society, we hope. And they're aware, like Heidi knows when people talk about people with Down syndrome and they use words like risk and burden and things like that. It's not great, is it? And you're not, like...
Yeah, I remember someone asked me for my children many years. I said, I'm 26.
Yeah, exactly, yeah. We do tend to infantilise people with disabilities, and I think that's a problem. Anyway, so the language poster offered a way, and it was agreed by every... National Down Syndrome charity, that was an accomplishment. Actually, the words like risk and abnormality and normal, when talking about typically developing babies, needed to be changed. And so we have tried to get this poster out. Public Health England accepted it. I wrote a blog on it. But the language keeps cropping up, showing that underlying discrimination in society, I think. It's a bit like playing whack-a-mole. You see it in a news article and you send them the poster and they say, oh, I'm really sorry. Then you see it in the National Institute of Health Research last week and say, oh yeah, we're really sorry. Would you like to contribute? Yeah, well, we would, but we're volunteers, we're parents, we've got other jobs. So actually that just shows that underlying discrimination which needs to change. And I think people get stuck, what we were talking about earlier, between the pro-choice and the respecting women and respecting people with disabilities. And what I would say is, this testing, prenatal testing, it isn't discriminatory in itself, but it does facilitate what I would see as discriminatory decisions. And is it ever right to have discrimination? I would say no. Thanks very much.
Thanks, Colette. And
if you want the poster, it's on my Twitter feed.
and also I've made a short link for it there.
Thank you.
So can I just close, let me put my details, close with the words of someone with Down syndrome, because they're the persons that actually we need to hear from. Am I a burden? Am I a risk? No, I'm a person with feelings. That's what I'm trying to get across. People with Down syndrome should be loved for who they are, not what they achieve. Thank you.